Thank you for that interesting presentation on what seems like a wonderful class. I want to start off by thanking Delta Omega for this recognition and award. I'm going to share with you about a project we've been working on for a while here at East Tennessee State University. And that's Project Earth, and innovation in education, and an education in innovation. So this started about 6 years ago. So we're going to be talking for about 20 minutes. So that's 110 days per minute if you're taking notes out there. So day one, with the support of the Niswonger Foundation and Hope Through Healing Hands, we had some of our students, both undergraduate and graduate, doing field placements abroad. Silas Tolan went to Sierra Leone. Beth O'Connell went to Rwanda. And they both came back and talked about how much they had learned from those situations and how they had worked with water. And they had both worked with biosand water filters, and we thought that was the most fundamental part of public health. Now, Project Earth is employing available resources we had was that we had not taught them how to work several things that we'll discuss. 3 things we'll discuss today, and several projects we have here. So about this time, Eastman Chemical Company donated this facility you see now. It's a 140-acre, what was a research farm, to the university. Well, that got us thinking about, could we help our students prepare to go into the field and take on some of these health challenges? And this led to a 15-week course called the Essentials course, and it teaches the essential skills, strategies, and expertise necessary to improve and advance low-resource settings. Our dean, Randy Wyckoff, is a acronym ninja. Thought this course would be useful in several settings. One is in a isolated area without basic services, following a disaster situation with displacement due to these disasters, and for Peace Corps volunteers, mission workers, anyone going into these low resource settings. In this course, the students learned to build with Adobe bricks. They learned to make ropes. They learned to plant tire gardens. They learned to build using low resource materials. So as you can see, it is a true hands-on course. Here's a rust pump that they made.
Yeah. It works. That's awesome. Oh man, I'm so happy.
Now that was the first time those students had ever seen a rust pump. Really didn't know how it worked, but they spent the day creating that rust pump with low-resourced hand tools. And you can tell that at the end of it, there was a lot of excitement. And after years of teaching, I haven't had too many students stand up in the back of the class and clap and shout when something goes correct. Now, employers have been telling us that they want students with technical skills. We need strong technical skills, but also the cross-cutting skills. Now, after teaching the essentials class a few times and having students at the site, we learned that it really wasn't just the technical skills they were learning. They were being put in a situation where they could develop creativity, problem solving. They could work in teams outside of what we do in the classroom. They could actually work in teams that had to solve a problem on paper and then solve that problem with their hands. And if if their solution didn't work, they would have to recreate that and keep working with it. And we learned soon that professionalism, communication, teamwork, problem solving, creative thinking, innovation, these cross-cutting skills were the real products coming out of the Essentials course. While the technical skills were there, it was these cross-cutting skills that are so hard to teach in a typical classroom setting. So as word got out with the Essentials course, we had more and more groups wanting to come out for a shorter experience, either a half a day or a 3-day experience. So we developed the skills experience, the shorter term knowledge, immersion, learning, and leadership skills experiences. Now these vary from a short term, a couple of hours of creating Adobe bricks, all the way up through a 3-day or 5-day pioneer experience. I want to share with you a couple of these experiences, starting with the tortilla experience. And this is where the students come out and they actually make a tortilla. A lot of times when they come out and we tell them they're going to do this, they have this face of disappointment. They've heard all these great things that they get to do here, and they think they're going to pour some flour out, add some water, and make a tortilla. But we tell them they need to do everything it takes to make a tortilla. And this includes clearing the ground, planting corn, making a fence, creating the rope, building a mold, building an adobe stove. Then once the stove is finished, they cook their corn in the stove, they grind the corn, and they cook the tortilla after they wash their hands with a hand washing station. And then they serve their tortillas. Now, if you can look at that on your screen, it's not exactly a Taco Bell product, but for the first time, we're always very happy with these tortillas. The takeaway for a lot of the students is they've spent 6 hours and they've created about 100 calories of a flour pastry. They also come to understand how much effort it takes to do these things. And some of them have never had these opportunities to clear land, plant, and actually process and cook like this. So most of the time we hear the students say they leave with a true appreciation for what it takes to create a simple food item like this. Second experience I'll share with you is the refugee experience. Now this one starts off with a group of people coming out to the facility, and we tell them they're going to have 50 refugees at noon, and they need to plan and be ready to take care of these 50 refugees. And everyone does a great job. They go through the list and they come up with what they need. We give them money to buy their materials at Uncle Randy's Mercantile. And they have to decide, is it worth buying a rake over Augmentin? Is it worth buying Skittles over a pot? And they go through our store and they come up with what they need. Now, a lot of times you think, well, the exercise is over. We did our planning. We prioritized. We had some strategic decision making to make, but no, now they keep going, and they actually set up their refugee camp. They have to set their pharmacy up, they set a medical tent up, they dig sanitation lines, they put tents up, they serve Rice Krispie treats, and at the end of this period they have a whole working refugee camp. But to add that real world flair to it, we have things happen during the setup. Now these include a tree falling on one of our workers, they have a lost child, they have explosive diarrhea victims, we have angry villagers come over and tell them they need to relocate, we have a thief to come in and steal their pharmaceuticals. So now the cross-cutting skills really come into play. You're doing your pharmacy, your clinic, you're setting up your shelter, your sanitation, but now you have to stop and deal with a thief, a medical emergency, the cultural aspect of neighbors coming over not wanting your refugee camp here. And we see this is the culmination of the technical skills and the cross-cutting skills. So we take the technical skills and we add on top of those the cross-cutting skills throughout the refugee experience and all of the skills experiences. The third phase of Project Earth we're talking about is a doctoral seminar course. This course puts doctoral students at the facility, and they're given a health challenge and low resource materials. This student made a spinning wheel out of a recycled bicycle. We have shoes, and we have an experience with shoes. How do you make shoes for people with low resources? Now, these may not look like the latest Nike shoes, but these students may have been given an hour or 2 hours and limited resources. So how would you make a pair of shoes? And then we talk about all the health issues related to not having shoes. We're making fuel briquettes, how we can make a fuel that is better suited for indoor cooking and can be made with recycled materials. And again, the students are given the challenge, resources, and they have to be creative to solve the problem. Now, while these students may never make fuel briquettes, we hope they take this same, and we've seen them take this same problem-solving strategies, creativity, innovation into hospitals and health departments. And when they're presented with the challenge there, they use the same approaches to solve those problems. And here's a group carrying water around the world, a major issue. Here's how to heat with solar power. A group made a solar heater that goes in a window and provides heat for low resource areas. Here's a bicycle, washing machine. Okay. Now, one of the last things I want to share with you is where we teach. And we've talked about low resource settings. We've talked about some students going abroad. We talked about the problem solving and everything else these students learn from this. But we wanted to come up and see, could we develop a way that students could experience some of these settings from around the world and in low resource settings while still on property? So what we came up with was a village where they could see firsthand the challenges, where we could take the lessons learned in the essentials course and put those into actual use, and we could stage certain real-world problems in a real-world setting. Not a tabletop exercise, not a rendering on a computer, but an actual real-world setting. Now, we have a video talking about our village, acronym NINJA once again, our village, and it encompasses everything we're doing in Project Earth. So I'll share that with you now.
When Eastman donated the ETSU Eastman Valleybrook campus, we quickly realized that this represented an incredibly valuable resource. I'm not aware of any other school of public health in the country that has access to resources like this. This allows us to have a platform where we can teach innovative courses, we can apply skills, we can bring in community members, we can make a real difference in the health of this region and the education of our students. The first part that we've been doing for several years is to learn the skills. We have the essentials course, we have a variety of a few hour to a few day training programs. We brought in high school kids all the way up to the leadership team of a local hospital. But at the end of the day, we realized we have to make sure that our students not just have the skills, but that they can apply them. And this is where the Niswonger Village becomes so important to us.
We're able to go from theory, from paper, from notebooks, to hands-on experience. We talk about health systems. We talk about health challenges, both domestically and international. Then we try to develop interventions and programming to improve health outcomes. We try to change environments, how we could maybe change policies, change public law to improve health outcomes. But here, they're given the chance to go to the next step. It's building teamwork, creativity. They're out here possibly in the elements. They can see each other's strengths and weaknesses. They learn to help each other. They learn to leverage those strengths. These are all things that we wouldn't be able to do without the village.
So the way to think about the Niswonger Village is as a public health simulation lab. Our job here is to create the kind of situations that challenge our students to use creative thinking, problem solving, teamwork, and innovation to really make a difference in people's lives. Go into this house and make it safer for a toddler. Go into that house and reduce the risks of an elderly woman falling. Go into the village and do a door-to-door malaria education campaign. So the key point is to understand that this is a simulation lab. We're creating real-world experiences, but what we're really doing is teaching our students creative thinking, problem-solving, teamwork, and innovation.
It was the coolest experience ever. I got to really get dirty and use my hands and create this awesome, cool, different experience that I never would have gotten, I don't think, anywhere else. The most different approach to teaching, and it's the most hands-on and real-world and applicable thing that I've ever seen.
All of these houses are actual replicas of houses from around the world, so that's really neat to see that people live in this mud shack that we're working on, and people live in this scrap metal house. I came from a very privileged life, and even in the area that we are here, there are a lot of disparities in healthcare that can be helped, but that no one is really focusing on. So being able to build these houses and prepare not only for us to be in a global setting, but being able to say, we're going to come across people who live in houses that are maybe not mud shacks, but they're going to be very low resource, and these people are not going to be very healthy, and they're not going to have access to the best health care like I do. So it definitely puts things into perspective.
It's not just a matter of replicating something that someone else has done or going through a role-playing scenario, as important as those are. I really want to teach the students to be able to identify problems and come up with creative solutions to address them. Well, one of the things we're most proud of with the support from the Niswongers is the fact that we share with them a commitment to improving this region, whether it's improving the education or health outcomes, and we're really trying to prepare students who can make a difference wherever they go in the world. It's really exciting to be here at the launch, but the launch, as with anything, is just the beginning. What I'm really looking forward to are the thoughts, ideas, and suggestions that other people have on how we can provide an even better learning experience out here. That, to me, is the really exciting platform that we're launching from today.
I'd like to take this opportunity to thank the Niswongers for their support for the village, and to thank ASBPH for the opportunity to share Project Earth. And with that, I'll turn it back over to Sarah.
Thank you so much, Mike and Christina, for sharing all about your courses. And I want to encourage all of the participants to please submit their questions or comments via the question box. And then we'll open it up to questions now. All right. This was asked, do you have any recommendations for faculty members who'd like to replicate in some way what you do at the Niswonger Village, but do not have a village and land to do that on?
Well, A lot of times with weather or anything else, we may do a mini refugee experience or something, and we may do it in a room still at the facility. But if someone had a room that they could use as a laboratory, and you had materials that could be in there for students to use, I think a lot of things it just depends on the outcome you want to have. But if you're looking at creativity and innovation, given some materials in a little space and then letting students have their time to experiment, I think it could be done in numerous settings. And I failed to mention one of the things that we've learned that is so valuable in this, and it can be done in a small setting, is letting students fail. Without failure, you can't have creativity. And we tell our students that a lot of times we want you to fail. And the way our academic systems work, we certainly don't encourage students to fail, and sometimes we frighten them so much of failure that it's not even a consideration to them. I think this could be done in a smaller setting, maybe not on such a grand scale.
That's great. Now, failure, that's a scary word for, I think, a lot of our students at our graduate schools programs. How many students have taken this essentials course so far?
We are on the 4th cohort of undergraduate students, so we're approaching 150 students approximately.
And have you made any changes from the first run through to now, and what is your ultimate vision for what this course could ultimately become?
Quality improvement is written on every wall, it seems. If something doesn't work, or even if it does work, we'll have an after action meeting, and we try to change what we can to improve the situation. We ask all of our participants and students what they received from it and how it can be improved. So we've made several small changes, maybe a couple of large changes. What we'd like to see out of this course is where the students as undergraduates develop these basic skills, and then throughout their master's and doctoral programs, there are other doctoral students come in and do research. We had one of our students researching water filters and how to make a low-cost indicator for the quality of water. So we hope that the essentials course is just the start, and then as they progress, they become more researchers, and we solve low resource health challenges.
Wonderful. Well, I want to say thank you to both of our presenters today, and certainly enjoyed learning about your courses and all the great things you're doing at your respective universities. I want to remind everyone who has participated that this webinar has been recorded, and it will be available on the ASPPH website in the archived event section soon. You will all receive an email with a link to that recording when it is available, and this has been approved for 1 hour of CPH continuing education credits. And please stay on the lookout for future webinars. ASPPH presents webinars that are always listed on the aspph.org homepage as well as the events page. And lastly, before I release you all to the weekend, a reminder, our registration is currently open for the 2018 ASPPH annual meeting and the Undergraduate Public Health and Global Health Education Summit taking place in early March in Arlington, Virginia. Thanks again to our presenters today, and have a wonderful weekend.